She's from Department of Psycho-Oncology, HCG and CHRI Cancer Center, Nagpur. And she's going to speak on effect of pranayama and mindfulness meditation on emotional distress and fatigue in adult hematological cancer patients under chemotherapy. Dr. Anjali, stage is all yours.
Thank you, ma'am. Very good morning to all of you, respected chairpersons and my dear friends. In this session, as ma'am has already told you the topic of my presentation, I am a yoga therapist and I work in the Department of Psycho-oncology in HCG Cancer Center at Orange City, Nagpur. It has been observed that stress, anxiety, depression, and fatigue are common symptoms during cancer chemotherapy. And this affects their quality of life and overall well-being. Therefore, there is a need for intervention during the treatment. Pranayama and meditation are vital components of yoga therapy. If you are unfamiliar with the terms, let me tell you, pranayama is regulated breathing practices of yoga, and mindfulness means being in the present moment and paying attention to the body sensations, thoughts, feelings, and emotions with acceptance, curiosity, kindness, and non-judgmental attitude. Studies have shown that pranayama and mindfulness meditation reduce emotional distress and fatigue in cancer patients. However, these studies are mostly conducted in breast cancer patients, and their effectiveness in hematological malignancy is relatively less explored. In this context, this study was conducted to evaluate the effects of 6 weeks of pranayama and mindfulness meditation on emotional distress and fatigue in adult hematological cancer patients undergoing chemotherapy. This was a single center randomized controlled trial. The sample size was calculated to be 30, 15 in control group and 15 in the intervention group. The data collection was done from April to November 2022. In this study, we included patients with hematological cancers, acute myeloid leukemia, acute lymphoblastic leukemia, multiple myeloma, Hodgkin's lymphoma, and non-Hodgkin's lymphoma. The patients were between 18 to 65 years of age. They were receiving chemotherapy, and we selected those patients who were ambulatory and capable of self-care. We excluded patients during induction phase of chemotherapy for acute leukemia because they are more likely to develop toxic complications of chemotherapy. Those having absolute neutrophil count less than 1000 were also excluded because they are more susceptible for infections. We excluded patients with hemoglobin level less than 10, those having respiratory distress, cognitive, psychiatric, or neurological illnesses, and those who practiced yoga or meditation in the past 6 months were excluded. Data collection was done using 3 questionnaires. At baseline, we used the psycho-oncology assessment, which is routinely used for our patients. This includes the demographic and clinical information of the patient, a brief medical history, and psychosocial details of the patient. Pre and post assessments were done at baseline and after 6 weeks using emotion thermometer and fatigue assessment scale. Emotion thermometer is a validated tool that has 5 domains: distress, anxiety, depression, anger, and need for help. For each domain, there is a visual thermometer as it can be seen in the image. The scores are from the range of 0 to 10, where 0 indicates least emotional distress and 10 indicates highest level of distress for each domain. Fatigue assessment scale, this is also a validated scale. This has 10 questions in which 5 questions measure physical fatigue and 5 questions measure mental fatigue. The total scores range from 10 to 50, and higher scores indicate higher levels of fatigue. This is the intervention. Those are my pictures, and the intervention had two components. First was slow-paced pranayama practice for 15 minutes, and this was followed by meditation for 15 minutes in lying down position. The pranayama practice included 5 types of breathing exercises. The first one was deep, slow abdominal breathing. The second one was Anulom Vilom Pranayama, which means alternate nostril breathing. Third one was Bhramari Pranayama. In this, there is a specific hand gesture or mudra, and in this pranayama, there is deep inhalation followed by a slow exhalation with a sound of In the fourth pranayama, Shitali pranayama, there is inhalation through the folded tongue and exhalation is done through the nose. And Udgit pranayama means chanting breathing. In this, there is slow, deep inhalation followed by a chant of Om. So these were the 5 breathing practices included in the intervention, and mindfulness meditation was practiced using a guided audio instructions in my voice. So this is the consort flow diagram. As you can see, in this study we screened 94 patients for eligibility. Out of that, 64 patients were excluded because 59 patients did not meet the inclusion criteria and 5 patients declined to participate. So initially we randomized 30 patients, 15 in the intervention group and 15 in the control group. The intervention group received standard medical care and intervention for 6 weeks. The control group received standard medical care. During follow-up, it was observed that 3 patients in the intervention group discontinued the intervention and therefore were considered dropouts. In the control group, there were no dropouts, and in the final analysis, we included a total of 27 patients. That is 12 from the intervention group and 15 from the control group. So these are the results. At the end of 6 weeks, we observed that the intervention group participants had significant reduction in distress, anxiety, anger, and need for help. For depression, the p-value was marginally insignificant, probably because of small sample size. For fatigue, we observed that at the end of 6 weeks, there was significant reduction in all the parameters of fatigue in the intervention group. Total fatigue scores, physical fatigue as well as mental fatigue, with a p-value of less than 0.05. This graph shows the effect size of the intervention, where out of all the 8 parameters we evaluated in this study, we observed that the largest effect size was seen for total fatigue scores, followed by mental fatigue and physical fatigue. For emotion thermometer parameters, the effect size was still large, that is coherence D value was more than 0.8, but relatively less as compared to fatigue. Now there are multiple proposed mechanisms by which the intervention component may have contributed to the changes they were demonstrated. The intervention components act on multiple levels simultaneously. They affect the physiological function. For example, there is increase in the parasympathetic activity, there is reduction in the cortisol level. There is emotion regulation component, that is mindfulness practice has been associated with training the mind to be more stable. Again, mindfulness practice has been linked with structural and functional changes in the brain, that is deactivation of the default mode network and downregulation of the amygdala activity in the brain. Yoga practice has been linked with improved mitochondrial function, which may contribute to reduction in fatigue. So in short, there is impact of the intervention on multiple symptoms simultaneously. And there is a complex interplay of factors because no single factor can contribute to fatigue. So, for example, if there is emotional distress, it can lead to insomnia, it can lead to fatigue, and fatigue in turn may result in psychological distress. So, there is a vicious cycle of all the complex factors going on simultaneously. So, in short, the intervention has both direct and indirect effect on emotional distress and fatigue. To conclude, the key messages of this study are 6 weeks of integrated pranayama and mindfulness meditation intervention reduced emotional distress and fatigue in hematological cancer patients undergoing chemotherapy. These interventions are feasible in the clinical setting and they focus on patient-centered care. In the study, no adverse event related to the intervention was observed. These interventions are non-invasive, inexpensive, and easy to learn self-care practices for enhanced treatment outcome. But there are a few limitations of this study. I would like to bring to your notice that this study had a small sample size and this was a single center study and we used subjective forms of assessment for the study. Therefore, there is a need for further validation. Thank you.